对，主要我的家庭服务的话，就是有住房咨询，还有就是申请福利的 ，OK。就像今天这个资源分享的路障会在我们有一个网站是可以想去看回放这些路障的 ，OK。然后还有就是一个资源分享的列表 ，OK， 就是说我们举办过什么资源分享，每周3的都可以回去看，然后我们就是提前在下周开始是11月了嘛，应该是11月了，下周开始对，我们下周3会做一个选文资源，就是去听一听说周人现在投票投什么，为什么要投票这些都会在里边的，都会成为他会AAU 的会过来讲所以就是留意一下我们的广告。然后我们每周五现在还有2周的周五，我们会举办一个就是 PA 是关于这个长者医疗的，主要是关于他们药物的。它是从州政府有一个部门，他会过来老年部，他们过来讲的。每周五，如果你要拿食物的话，我们也会帮你拿1箱食物的，所以你可以打电话过来登记，就是每周五是不是还有2周的讲座。然后还没打针呢，今天我自己也会打了，就是打他的这个叫3效疫苗，就是每周3都可以打了 ，OK， 现在都有可以在我们里边打 ，OK， 然后还有这个不是这个是3周的，我们每周五都会派食物的 ，OK， 就是提醒大家一下，就是投票 ，OK 如果你是不想去这个选票站去投票的，可以要求他们邮寄选票到你家 ，OK， 11月1号之前要登记，他们才会把选票寄到你家，你就可以填好之后给交回去就可以了，就不用当天再去投票站了 ，OK。11月8号是代选 ，OK。这个是好心的，就是12月17号我们有一个 celebration， 就是社区之声的年度庆典是第2年做了，就是主要就是庆祝一下我们社区的在小成就还有就是感恩这些义工帮我们参与者，还有义工就在你们现在经常就上来听我们讲座这样子，就是大家一起就是做一个活动，就是12月17号我就会有更多资料。所以我现在这里我就先不讲这里了，我现在呢就是交给 David 去讲关于他的部分。David, I actually kind of move some stuff so I can fit everything in there. Let me actually go from why? Okay, I'm gonna just go back from the beginning. Okay, 现在我们就是让David 去讲一下关于他关于这个红蓝卡老人，还有就是老人医疗的。Okay, David, your turn.
Thank you. Good morning, everyone. My name is David Johnson, and I'm here with the PA MEDI Program to talk about Medicare, what it is, Medicaid, what options there are, what the open enrollment period is, and how to get free help.
他是从这个叫 PA MEDI 的，就是下面说宾州医疗保险教育的他们过来他们会他过来讲一下关于这个红蓝卡是什么怎么申请还有什么选择怎么登记这些他都会在哪里得到帮助，他都会今天讲的。OK， 就当。
To be more detailed, we're going to talk about what the PA MEDI program is. We will talk about the basics of Medicare, how it works with other insurances.
他现在再讲几次，就是说他今天会讲一下他们是什么部门，有一些就是红蓝卡的最基本的部分的费用这些，然后还有就是怎么去换这个计划。
We'll also talk about Medicare penalties, how to switch plans and when to switch plans, programs that can save money with Medicare costs, and where to find free help.
然后他会讲一下，就是如果这个红蓝卡有些人说罚款怎么换计划，然后还有没有什么其他的计划可以帮忙这个去省这个费用，还有在哪里得到帮助。
PA MEDI is Pennsylvania's State Health Insurance Assistance Program, or SHIP. This is a program that's available nationwide, and in Pennsylvania, it's called PA MEDI.
他们这个部门是它是宾州州政府的一个保险援助计划 他在宾州这里的话，他们是叫做 PA MEDI。
So if you have friends or family that live in a different state, the same type of free assistance is available to them as it is to you. In Philadelphia County, CARIE organization I represent and Einstein Medical Center provide this free service depending on where folks are calling from by zip code.
就像如果你有朋友他们是在其他的州他们其实都有这些的服务，这一类型的服务机构了。OK， 在宾州的话，他们在费城的话，他们是有一个机构是叫 CARIE， 它是专门是做这些的。
Great, next slide. So the primary function in the PA MEDI program is to provide counseling, free, unbiased, objective, fact-based information about Medicare and Medicaid.
他们最主要的服务就是提供一个免费、公正的、个人化的这个咨询，就是让大家去了解什么是这个红蓝卡。
We can provide an explanation about different Medicare coverage options like Medicare A and B, Medicare Advantage, Medicare Part D or prescription drug plan, Medigap, and other types of insurance that works with Medicare.
他们就是也可以去解释，就是外面有什么保险的计划，就像 A 部分、B 部分优势计划，这个 D 部分呢，还有就是哪些拿药的部分，还有就是一个 Medicare Gap， 然后还有其他的这个保险。
We can help with filing appeals, helping understand complex Medicare rules, and help people get connected to programs to save money under Medicare.
然后他们也可以帮忙提去这个上诉，如果是有问题的话，跟红蓝卡这个有问题，他可以帮你去提去上诉，然后就是因为然后去解释这个为什么那个红蓝卡的这些规矩为什么那么复杂啦这些他们都可以帮忙的。
Next slide, please. So predominantly our services are one-on-one. Our counselors work with individuals. Typically, we're making those appointments over the telephone or through video conferencing like Zoom or Skype. On occasion, we may have some in-person appointments available under special circumstances.
然后他们通常最主要是提供1对1的服务 ，OK 通常就是一个咨询就是个人化的咨询服务，通常都是透过电话，可能用视频，就是用 Zoom 还是用这个 Skype 有时候也会预约时间去面对面的。
And yes, so let's start with the basics of Medicare, what it is, how to enroll, the different parts of Medicare, some costs associated with it, and what type of options you have with Medicare coverage.
他先讲一讲这个红蓝卡最基本的知识就是这个资料什么是这个红蓝卡，就是 Medicare 怎么报名他们的部分有什么，然后费用是多少，然后他们涵盖的是什么。
Just want a previous slide if you don't mind.
Okay.
The card here, the red, white, and blue card. This is if anyone has Medicare Parts A or B or A and B, they'll be issued this red, white, and blue card from Medicare. This shows a person's name, their Medicare number, which should be kept safe and secure, and when they enrolled in Parts A and or B.
他就是想说一说上面的这一个红蓝卡，我们叫做红蓝卡吧 ，OK Medicare 的卡就像右上角这一个，它是上面有名字，有这个 Medicare 的号码，你的这个号码，然后里边有会说你的 A 部分是什么A 部分 B 部分是什么时候开始的，只有哪些有 A 部分还是 B 部分的人才会有这张卡。
If you have Medicare or you think you have Medicare, but don't have this red, white, and blue card, you can get a replacement for free by contacting Medicare.
如果你因为你是有红蓝卡的医疗的，可是没有这个卡的，你是可以联系这个社会保障安全局他们退休局他们去要求他再给你一张卡。
So generally speaking, what is Medicare? Medicare is a federal health insurance program for people who are 65 years or older, or people who are 65 under the age of 65 with certain disabilities like end-stage renal disease, Lou Gehrig's disease, or other disabilities determined by Social Security.
这个联邦Medicare 红蓝卡的联邦保险计划是什么呢？它是给65岁以上的人，5岁以下的是有某些残疾的人，就算如果有晚期肾脏疾病，有这个叫卢卡雷氏病吧 ，Lucas disease 然后还有其他残疾是由他们社会保障局退休局他们确定的。
So to qualify for Medicare, you must be a U.S. citizen or a legal immigrant for at least 5 years. And important to emphasize that Medicare, federal health insurance, is different than Medicaid, which is a state-run program.
还有就是你必须是美国公民，如果不是美国公民的话，你必须是合法的移民，最少是有5年的。然后再就是提醒一下，他们这个 Medicare 红蓝卡跟这个Medicaid 就是政府医疗，联邦就是州政府医疗是不一样的这个 Medicaid 是州政府给的。
So there are 4 parts to Medicare. The first 2 we'll look at are what's called original Medicare. This is Part A, hospital insurance, and Part B, medical insurance. This is often represented by the red, white, and blue Medicare card.
然后这个 Medicare 联邦医疗呢，其实有4个部分 ，OK，通常如果你有 A 部分是医院的保险 ，B 部分是医疗的保险，有 A 跟 B 的话就会有这个红蓝卡了。
Part C refers to a Medicare Advantage plan or managed care Medicare. This incorporates Medicare Parts A and B, usually also includes prescription drugs or Part D, and it is bundled together into one policy offered by an insurance company.
也还有一个4部分呢，他们就是叫这个优势计划，通常大家都已经包括 A 包括 B 部分，然后还有 D 部分了。通常这个4部分的话是从由这些私人保险去提供的。
Part D is Part D is prescription drug coverage, which is purchased either through a standalone drug plan or it is bundled together in a Medicare Advantage plan.
然后 D 部分的这个处方药的计划，通常也可以是单独的一个计划，也可以是跟这个 C 部分是已经包括在 C 部分里边的。
Medicare Part A is hospital insurance, and in the interest of time, I'm just going to read the top headings here. Part A covers hospital stays, including psychiatric stays, skilled nursing care for a limited basis, hospice, home health care, and blood.
然后 A 部分刚才说了，就是你看它就是医院的保险，你看就是入室的标题的话，就是包括你住院，住院人中的关怀学医就是这个学医方面的，然后还有就是物理，然后还有就是家庭健康的物理。
Medicare Part B covers medical insurance or outpatient services. This includes outpatient medical care, home health care, preventative care, ambulance, blood and some prescription drugs, occupational and physical therapy, labs, x-rays and tests, and durable medical equipment.
然后这个 B 部分的医疗保险呢，它是包括你去看门诊的医疗家庭健康物理预防保险、救护车血液还有药物就是一些就是在医生里边的办公室里边的药物，然后物理治疗就是实验室 X 光测试还有这些拿的这个医疗thiết bị都是包括在里面的。
Quite infamously, Part B does not cover most dental care, eye exams related to prescribing eyeglasses, or hearing aids and exams for fitting them.
然后呢，就是就是可是这个 B 部分它是不包括这个眼睛、牙齿还有听力方面的这些是不包括在内的。
Medicare Advantage plans or Part C bundle together different component parts of Medicare like A and B and often prescription drug coverage and is offered through a private insurance company.
然后刚才说了4部分基本上它就是 A 部分、B 部分加 D 部分的 ，OK 通常他们这些保险这一个 部分的话都是由私人保险去提供的。
Medicare Advantage plans must cover the same benefits that original Medicare covers, Parts A and B, though these plans may choose to offer some extra benefits, which commonly include routine dental, vision, and wellness benefits.
然后这些计划就虽然它是私人保险去提供的，可是他们必须跟原来的这个红蓝卡 Medicare 联邦医疗包含的福利是一样的，有时候他们会提供更多的，就包括眼睛、牙、耳朵就是听力方面的这些都会包含在内的。
The most common types of Medicare Advantage plans are HMOs, PPOs, and special needs plans. Generally speaking, depending on the type of Medicare Advantage plan you have, costs may vary or be different, and how you access doctors and providers will change as well.
然后还有最常见的这些优势计划，他们通常只有3种的，有 HMOs、PPOs、SMPS， 你看到里边的名字 ，OK 其实主要就是说不同的计划，他们的要求费用不一样，然后他们有可能需要介绍信，也可能不需要，就是根据你的计划是什么的。
Medicare Advantage plans also cover specific service areas, and that are not uniform across the state of Pennsylvania. So your Medicare Advantage plan, apart from emergencies, you can only use in specific geographic areas.
因为这些保险他们也是有地区分的，所以有可能你在这个地区拿的这个保险呀，必须是在这个地区才可以用的。
Medicare Part D, or prescription drug coverage, offered through private insurance companies, and it's either individual through a Part D plan or bundled together with a Medicare Advantage plan.
然后呢，这个 D 部分的处方药的话呢，有可能是可以单独去买的，也有可能是可以就是已经包含在这个 C 部分的优势计划里边。
Although the Part D prescription drug benefit is standardized by Medicare, coverage depends on the individual plan's drug formulary and can change at any time. So it's very important to make sure that your prescriptions are on the drug formulary when enrolling in a drug plan.
然后他们这个因为也是不同的这个公司，所以有可能这个计划里边也不一样，所以就是非常重要，就是你要看一看你需要吃的药是不是在你这个承保的范围里边，是不是在他们里边可以承包的这些范围里边。
Medicare drug coverage is for prescription medications only through a Part D benefit or with a Medicare Advantage plan with prescription drug coverage. Drugs that are purchased over the counter will not be covered.
这个计划只会就是帮你就是承保，就是你医生开给你的药，如果不是医生处方药开给你的话，也就是你去药房去买的这些都是它不会包的。
So we are currently in a period called the annual open enrollment period from October 15th to December 7th. This is an important time of year to review coverage because Medicare Advantage plans and drug plans can change their costs, copays, benefits, and premiums each year.
然后现在呢就是每一年的公开注册期间，就是从10月15号到12月7号这个期间呢，就是非常重要，你要去看一看你下一年的这个保险是怎么样的，尤其是如果你是优势计划的话，它每一年他们整个公付费保险费用也有可能是不一样的。
So for anyone who has a Medicare Advantage plan or a standalone Part D plan, there are opportunities to review changes to the plan that may take place next year or to otherwise change to a new plan using tools available on Medicare's website or with free help and assistance from PA MEDI.
然后呢，现在是一个机会，就是去把你的计划去改计划 ，OK 呀，就是去看一看现在这个计划下一年的计划有没有改变。如果你是也可以去改另外一个计划然后你就是可以用他们政府的网站他们政府有一个网站可以上去看，也可以去找一些免费的帮助，去帮你去找一个好的，就是适合你的保险。
In the interest of time, I'm going to cover just a few points here. Original Medicare famously does not cover a lot of things that older adults and Medicare beneficiaries need. I'm going to highlight long-term care and homemaker services. For individuals who do need long-term services and supports, they need help living safely and independently at home in the community or in a skilled nursing facility. Medicare will not cover this on a long-term basis, but someone might qualify for Medicaid services, and PA MEDI can help identify whether that's the case or not.
然后呢，还有就是什么是原起的 Medicaid 红蓝卡是不涵盖的，因为你没有其他优惠计划，就是只是拿红蓝卡，它是什么不涵盖？他想最主要说的就是这个长期护理 ，OK 这个是通常他们是不包的 ，OK， 然后就是如果你家里找一个就是家庭护理的 ，OK， 家政服务的 ，OK， 他也是没办法包的，可是有可能你是可以去得到这个州政府的医疗去帮你去付这些费用，那么你就可以他们 PA MEDI 也是可以帮忙去如果你符合的话也可以帮忙申请。
Generally speaking, Medicare is not free, and there are different costs associated with it. And we'll talk later about ways to get help with Medicare costs for those who qualify.
然后呢，这个红蓝卡联邦医疗费是不是免费的？它是有一个费用的。OK， 它之后也会说一说有没有其他计划是可以帮忙付这些费用的。
So looking at Medicare Part A or hospital insurance, first there's a monthly premium, and a premium is just the cost you pay per month just to have the coverage.
然后他们呢，这个红蓝卡它是有每个月的保费的 ，OK。
If you've worked 40 qualifying quarters and paid FICA taxes or Medicare taxes, you will qualify for premium-free Part A or $0 premium.
就是如果你是有工作够40个点的 ，OK， 通常说10年吧 ，OK， 然后你有付这个叫 FICA 还有这个 Medicare 的税 ，OK， 这个你要交这个税了，通常在工资里边扣了，就够40个点的话，那么你拿红蓝卡的时候，这个 Medicare 的时候 ，A 部分是不需要钱的。
And if you have not worked 10 years or have paid 10 years worth of Medicare taxes, you may have a monthly premium for Part A, and Social Security would tell you what that would be.
然后如果你不够40个点的话，要拿这个 A 部分的话呢，通常需要付一个月费的 ，OK， 通常你的退休局里面会告诉你是需要付多少钱。
A deductible is the amount of money you have to pay before your insurance starts making contributions to the cost of your care. So for Part A, there's a deductible of $1,600 per benefit period.
然后呢，还有一个叫先付费用，就是你要先付了之后，保险才会生效的。所以就算 A 部分的话呢，每个福利期你是需要先自己付1600块钱，然后保险才会生效的。
And there's also contributions made toward the cost of your care apart from a premium and deductible. And for inpatient hospitalization and skilled nursing facility, the dollar amounts are listed here on the slide.
然后还有你要分担费用 ，OK， 他们帮你付一部分，你自己付一部分。就算你住院的话，你有可能需要付一些钱。然后还有就是，如果你要专业的护理场地里边的话，也是需要付钱。里边有说每一天是需要多少钱的。
For Medicare Part B, there is a monthly premium of $164.90 per month, and this is usually deducted from an individual's Social Security award.
然后 B 部分呢，它是有164块9毛每个月的保费的，通常也是在这个退休金里边扣出来的。
For Part B, one has to pay $226 per year before Medicare starts making contributions. This is the deductible. And for cost sharing under Part B, beneficiary pays 20% of the Medicare approved amount.
然后还有，当然它也是有先付费用，还有分担费用的。先付费用是需要付226块钱每一年然后就是付了226块钱，然后它保险才会生效了。然后还有你分担费用，通常都是20%。如果他批准了一个费用的话，里边的20%你是需要付的。
A lot of Medicare beneficiaries will try to protect themselves financially by purchasing either a Medicare Advantage plan or a Medigap plan to help with these costs or to have them managed more reasonably. People might also qualify for assistance programs to help with Medicare costs.
然后很多人他们通常都去购买一些，就是可能是这个叫优势计划，还是 Medicare 啊，还有就是也有可能申请政府又是一些款做去帮忙去付这些费用的。
So there's many different ways to get Medicare coverage, and you could think of it as a puzzle. Now, these different pieces of Medicare coverage can go together, and some configurations may be more beneficial to others than some other types of coverage. And this slide outlines the 4 common ones, and I'll go through each.
然后基本上这些保险计划呢，就像一个就是拼图一样的，就是不同的拼图可以就是有不同的保险是可以，就是计划是可以跟着它的，它上面就会有说是可以什么跟什么一起用的。
Original Medicare, which is just parts A and B, can be paired with a standalone prescription drug plan, or it also could be paired with a standalone prescription drug plan with a Medigap plan.
然后它就是原起的红蓝卡那个Medicare， 它是可以单独的另外再买一个低部分的这个药的这个计划，也可以买了这个低部分的药计划，再加一个 Medigap 的计划。
Someone may opt to get a Part C or Medicare Advantage plan, which bundles all these benefits together and may or may not have prescription drug coverage.
也有些人可能就是去申请这个 C 部分的优势计划，里边也有可能有，也有可能没有这个药的这个保险。
Some people may have original Medicare with insurance from other coverages. This could include TRICARE for life, employer coverage, healthcare through the VA, or Veterans Administration, or retiree coverage.
有些人他们只是有原起的这个红蓝卡，然后他就是加其他的计划，就可能有一些可能是退休军人的这个也有一个保险啊，还是雇主有一些保险啊，这些都有可能的。
I'm going to breeze through a bit here on the Medigap policies. Medigap policies work with original Medicare, Parts A and B. They provide supplemental coverage to costs that original Medicare does not pay, and this includes deductibles, co-pays, and co-insurances.
他很简单的讲一讲这个叫 Medigap， 就是一个就是去这个保单它是怎么样，它基本上是就是如果你原始的红蓝卡是不包的，它就会帮你付 OK 一部分，有可能是全包付剩下的这些费用。
Medigap policies do not include prescription drug coverage, and they do not work with Medicare Advantage plans.
这个 Medicare 它是不会是不包括这个药的，在这个低部分的在里边的，也不会是跟这个优势计划你不可以两个一起用的。
Next slide, please. So there are different Medigap policies sold by private insurance companies, and they are standardized policies that are identified by letters A, B, D, G, K, L, M, and N.
因为这个 Medicare 的也是私人保险卖的，他们通常有这些保单呢，都是有用一个字母去代表的，就是 A, B, D, G, K, L, M, N.
Medigap policies are standardized, meaning that if you have plans with the same letter must offer the same benefits, even if they're sold by different companies. So if someone has a Medigap N policy from one company and another person has an N policy from another company, the benefits are identical, but what may be different is the price of that plan and the service of the company.
他就说这些保单呢，不管你是什么，它是标准化的，不管如果是同样的字母，不管你是在不同哪一个保险公司买的。他们保的东西都是一样的，可是问题是它有可能这个价钱是不一样。
Unlike other types of Medicare coverage, these policies must be applied for, and outside certain periods, these companies can conduct medical underwriting, or they can do a health assessment to see whether they will approve the application or not.
然后这个跟这个联邦的 Medicare 红蓝卡不一样，他们就是可以说自己有一个规矩，就是说有可能需要做一个评估，有可能看你的年纪还有就是评估一下你的状况。
In the interest of time, I'm going to summarize this slide here. Generally speaking, there are differences between getting Medicare benefits through original Medicare or a Medicare Advantage plan. And generally speaking, they will differ in terms of their costs, what they cover, and how benefits are accessed.
然后呢，那么究竟这个原始的红蓝卡 Medicare 跟幼师这块有什么区别呢？这个 C 部分有什么区别呢 ？OK， 最主要的区别就是他们的费用，还有他们都是包的东西，还有就是怎么去用这些福利。
These comparisons can be very meaningful or impactful for any individual beneficiary, and for someone who is weighing their options between original Medicare or Medicare Advantage plan or other types of coverage options, PA MEDI can offer free individualized help.
然后因为每个人的需求不一样，所以有可能这些不同的东西对某个人是非常重要的。OK， 所以他就说他们就是 PA MEDI 就是他们是可以帮忙去看一看究竟哪一个是对你来讲是比较好的。
So generally speaking, we'll talk about different enrollment periods with Medicare, how people join Medicare for the first time, and some other times throughout the year, or depending on certain circumstances that someone can change their Medicare.
然后就是怎么申请这个联邦的红蓝卡啦 ，OK， 就是要看这个时间线。
Next slide, please. When someone first joins Medicare, this is called their initial enrollment period. And this is the first time someone's allowed to join Medicare Parts A, B, D for prescription drugs, or a Medicare Advantage plan or a Medigap plan for the first time.
OK， 然后它有一个最初的这个登记的期限，这个登记期限基本上就是这个人第一次去登记去拿这个红蓝卡的福利，他可以去选择是要 A 部分 B、C、D 还是需要这个 Medigap， 就是在这一个期间里面都可以去选的。
If someone's becoming eligible for Medicare by turning 65, they will have a 7-month initial enrollment period. This is 3 months before their 65th birthday month, the month of their 65th birthday, and the 3 months after their 65th birthday month.
这个基本上是有7个月的时间是可以去登记参加了 ，OK， 就是他生日就是刚刚好65岁哪一个月之前3个月，加他生日的这个月，然后再加之后的3个月，所以总共是7个月的。
If an individual misses their initial enrollment period, there are other periods in which they can enroll, but there may be some penalties associated with it.
因为他这7个月是没有去登记的话啦 ，OK， 他有其他时间可以登记，可是可能有罚款。
The general enrollment period is each year from January 1st to March 31st. This is the opportunity to join Medicare Part A or B for the first time if they missed their initial enrollment period.
如果他们就是你从来没有参加过，第一次参加了 ，OK， 你错过这7个月的话，你可以之后的。OK， 1月到3月是可以去参加了。
Generally speaking, if an individual does not join Medicare when they're first eligible and otherwise does not have other approved coverage, they may incur late enrollment penalties.
然后他们就是如果你晚的去登记的话呢，有可能有一个罚款的。
Late enrollment penalties are paid in addition to monthly premiums for potentially Part A, Part B, and Part D.
这个通常是就是你每个月需要付月费保费之外，还要加这个罚款的。通常就是如果你要是登记这个红蓝卡的 Part A， 如果你需要付钱的话，然后 B 还有跟 D。
The penalties will vary in how they're calculated, whether it's applied to Part A, B, or D. Point I would underscore is if you are eligible for Medicare coverage, there are benefits to enrolling as soon as possible to avoid the possibility of late enrollment penalties.
OK， 他的建议就是说，如果你真的如果你是合资格了，就尽快的去申请，不然的话，你有可能就是损失一些福利啊，还有罚款了。
So if someone is still working and they are 65 or older, there are some special considerations to think about.
如果这个人还是在工作的，他也是65岁以上的话，他是有一个特殊的情况，是有可能不需要罚款的。
So there are opportunities to delay Medicare enrollment without incurring late enrollment penalties or paying premiums for coverage that is not necessary.
他就是说有可能你在工作的时候 ，Can you repeat that? Just listen.
Sure. There are ways to delay Medicare enrollment in Medicare Parts A and B without incurring or getting late enrollment penalties. And not needing to pay premium for Medicare coverage that's not needed.
OK， 他就说如果你是在工作了，其实是有一个办法，有好多不同的办法是可以延期去登记 A 部分跟 B 部分，而且不需要交这个就是罚款的，也不需要交这个月费的。
If you are currently working and have health insurance through your employer and are becoming Medicare eligible, whether you want to delay Medicare enrollment or not is going to depend on the size of your employer and what other costs might be associated with it.
如果你是打算延期登记这个红蓝卡的话，你要去考虑一下你的保险。如果你是雇主的保险，你要就是了解你的保险公司不是你的雇主的你的公司是多大了，因为有可能他们会不会接着去帮你付。
If you're actively employed and covered by a group health plan for an employer large enough, you can delay Medicare enrollments and use what's called a special enrollment period to enroll later without getting a late enrollment penalty.
如果你是还在工作了，然后你现在的保险是一个一组的这个健康保险，就是你公司帮你整组人一起去买的保险的话呢，你可以去延期你这个登记 ，OK， 因为他们会有一个特别的登记的期限，让你去登记的。
Next slide, please. Similar rules apply to delaying Medicare Part D while still working. There's the prospect of getting a special enrollment period if your employer offers creditable prescription drug coverage.
然后如果你要延期你第一部分的这个药的部分的话，你要知道你的你现在还有没有这个特别的就是登记期限，然后然后你是不是有这个你的现在这个药的保险是不是可用的？
If you're still working, have employer health insurance, and are approaching Medicare eligibility, I would summarize, talk with your human resources department or call PA MEDI. There's likely an opportunity to delay Medicare enrollment without any consequence.
如果你现在还在工作的话呢，你可能就是跟你的这个人力资源，就是请你的这个部门看看他们现在还这个保险是怎么样的，然后如果你也可以找他们 PA MEDI 去跟你看看你可不可以延期这个这个第一部分的登记。
You can skip this slide as well as the next one. You can skip this slide as well. So let's talk about when an individual can change their Medicare plans. It's going to depend on the type of Medicare plan we're talking about, but let's look at a few enrollment periods.
然后现在他是想讲一讲，就是什么时候可以换这个计划。
The first we'll talk about is the Medicare annual open enrollment period, which is happening right now. It's October 15th through December 7th each year.
就是他们首先先讲的就是这个红蓝卡了联邦医疗它每一年的这个公开登记期限 ，OK， 就是现在已经开始了，10月15号到12月7号。
Between October 15th and December 7th, you can join, switch, or disenroll from a Medicare Advantage plan or Part C or Part D plan during this period, and it would go into effect on January 1st.
然后你的这一个期限的话，你是可以登记去参加，可以换，也可以说我不要这个 CND， 就是这个优势计划还是低部分的药计划，然后这个生效期是1月1号。
There's also what's called a Medicare Advantage open enrollment period, and this runs from January 1st to March 31st.
然后还有一个是红蓝卡优势计划的公开登记期限 ，OK， 这个通常是1月到3月份。Just like kind of like a little confused. So like going back like here, so you are also so they cannot enroll into Advantage plan. They can disenroll.
So during October 15th to December 7th, you can join, switch, or disenroll from a Part C or Part D plan.
Okay, so what is the difference on this one then?
Sure. So if someone on January 1st has Parts A and B in a drug plan, they could not join a Part C plan during this period. However, if on January 1st through March 31st, they have a Part C plan, but wanted to switch it or drop it to original Medicare A and B, they could do so during this time.
Okay.
So the big difference between the two is if someone wants to join a Medicare Advantage plan outside of their initial enrollment period or a special enrollment period, they would have to join it during October 15th to December 7th.
Oh, so this is kind of like a kind of bigger enrollment period for everything.
Correct. This one encompasses Advantage plans and drug plans, and it is right. It's the time to join, switch, or drop, as opposed to January 1 through March 31st. That's just a switch or drop. You would already need to have a Medicare Advantage plan to take advantage of this.
Okay, got it. Yeah, because I was looking at the timeline, so just a little confused. Okay, so now I got it. Okay, 刚才说的10月15号到12月7月，你就是可以去参加，也可以换，也可以不要。OK， 所以是什么都可以做的。OK， 10月15号到12月7号。OK， 可是这个1月到3月份的话呢，如果你是有这个优势计划的话，你可以选择。OK， 你如果没有优势计划，这一个期间是不可以登记的。这个是给哪些已经有优势计划的人可以换计划，也可以说我不要了这个计划。So they can, yes, okay, they can switch or disenroll, yes， 可以转，也可以说不要了这个优势计划。Okay.
Excuse me, can I have a question?
Is it related to this?
Yes.
Yeah, sure.
What's the difference of Medicare Advantage versus the last slide Medicare plan? Can one people hold two plans or just one?
Well, I would just jump in. So yes, we did go through that before. There's a couple slides about the difference between the Medicare and Medicare Advantage plan. I don't think we can spend the time to go back and explain unless David, you can like explain it in a short way.
Sure. If I understood your question correctly, can you have two Medicare Advantage plans, correct?
Medicare and Medicare Advantage, because we have so the patient can only hold either Medicare or the Medicare Advantage. They have to choose between these two, either of them, right?
Generally speaking, yes. And I can answer this quickly, and I can make sure that you've got information for follow-up questions as needed. When someone becomes eligible for Medicare, right, oftentimes they're enrolled in Medicare Parts A and B, or original Medicare. If someone chooses to join a Medicare Advantage plan or Part C, You could think of that as being Medicare coverage that is superimposed over original Medicare. Medicare Advantage plan must cover an individual's parts A and B benefits, oftentimes includes their prescription drug coverage, and may offer some of these additional benefits as well. When someone's enrolled in a Medicare Advantage plan, they still keep their original Medicare card, the red, white, and blue card. Keep that safe and secure. That still is important, has value. Don't give it away or destroy it. But when you go to the doctors, they will, if you're enrolled in a Medicare Advantage plan, they need to take that Medicare Advantage plan. So that would be the primary Medicare insurance.
So, I do know a couple of seniors, and they do want to enroll in Medicare Advantage. So who shall they contact? I can give their information. They can contact the.
Sure, we'll get to that at the end.
Yeah.
Okay.
Yes. Okay. Yes. So Dave, just let me also just translate that so people know what's going on. 刚才就是有一个问题，就是说就像这两个 slide， 我刚才也是就是问清楚这个时间线 ，OK， 就是这个 Medicare 就是原来的红蓝卡，跟这个 Medicare Advantage 这个 C 部分呢，是不是可不可以一个人有两种，就是两种保险都有？其实每个人都已经是有这个红蓝卡了，这些人都是必须要有这个 Medicare 红蓝卡原始的红蓝卡。他们才可以参加这个 Advantage Plan 这个优势计划 C 部分的，因为这个 C 部分他们涵盖了，就已经是涵盖了这个原始的 Medicare 红蓝卡 A、B 部分，然后再加上有可能加上 D 部分跟其他一些更多的福利，所以他们原来从这个红蓝卡为主的医疗变成是这个叫优势计划的为主的医疗，可是这个红蓝卡不要丢，因为有红蓝卡你才可以申请这个优势计划。Okay, yeah, so I just kind of explain about it.
Thank you.
Okay.
So we definitely encourage people to look at Medicare.gov. It is the federal government website where you can create a personal Medicare account. You can look at your claims, payments, your Medicare card, and other important Medicare-related information.
因为他是非常鼓励大家去上去他们这个联邦的一个网站，就是 Medicare.gov。OK， 因为你在上面如果建立了一个账户的话，可以看到你的这个保险里边的资料，然后就是你就是申领了多少钱，他们帮你付了多少钱这些都会在你付了多少钱的这些都会在里边的。
PA MEDI recommends that people create an account before an appointment with a PA MEDI counselor. This allows the person to save their prescription drug information and to verify current coverage as well.
通常他们都建议就是先在这个网站上面去登记一个账户，然后呢才去约他们这个 PA 他们的这个顾问，这样子他们就可以把所有的资料都会传到这个账户里边。
When looking at Medicare plans, whether it's a drug plan or a Medicare Advantage plan, it's personalized. A plan that's good for one person may not be a good plan for another person.
然后这些计划呢，里边有不同的计划，然后这些计划都是要根据每个人的需求的 ，OK， 是非常个人化的 ，OK， 有可能这一个计划对这个人是很好，可是对另外一个人可能不太好的。
Depending on what prescription drugs you may be taking or which doctors you have or what your budget is, it's important to look at Medicare options that are going to be best for you individually.
然后也要根据这个人他们吃的药是什么，要看什么医生，然后还有他们大概可以负担得起多少的费用，这个就是要看这些才可以更好的去选择。
Some people on Medicare simply can't afford Medicare costs, and thankfully there are some financial assistance programs to help those who meet certain income and resource guidelines that can help save them money.
然后呢，当然有很多人是没办法付这些费用的，所以其实外面有一些是可以就是省去这些费用的计划，是帮哪些可能收入合资格还是资产合资格人的去负担这些费用。
Three different ways to save money. We'll review our Medicare savings programs, the Extra Help program, and PACE and PACENet.
最主要有3个，就是 Medicare， 就是这个 Medicare 的就是省钱计划，还有一个特别帮助的计划 Extra Help， 然后还有 PA MEDI 的计划。
Medicare savings programs can help with the payment of the Medicare Part B monthly premium and other Medicare cost sharing for co-payments and co-insurances, depending on which Medicare savings program someone qualifies for.
然后这个 Medicare 的这个省钱计划呢，基本上就是帮忙去付这个 B 部分的月费，然后有可能也会帮他付就是这个20% 还是共付费啊这些红蓝卡不付的费用，可是也要根据这个人的收入还有资产才确定是帮他付什么费用的。
There are a number of different Medicare savings programs, and the most generous of them would include full Medicaid.
就是有不同种类的这些计划，可是最主要的通常都是这个Medicaid 州政府的这个医疗计划。
Applications are submitted through the County Assistance Office.
这个申请是从这个福利部里面去申请的。
The Extra Help program is administered by the Social Security Administration, and it's also known as the Low-Income Subsidy.
也还有叫一个 Extra Help 的计划，这个是这个退休局他们去管理的，这个申请也是他们接受的。
Extra Help can help lower or eliminate many of the costs associated with prescription drug coverage, and a person may have very low copays for medications, just a few dollars.
OK， 这一个计划主要就是帮忙去降低还是去付了这个药的费用的。OK。
If someone has Medicaid, they do not need to apply for Extra Help. They'll qualify automatically.
然后这个如果是已经有州政府的医疗的话，申请到的话，你就不需要再申请这个 Extra Help 了。这个 Extra Help 基本上自动就会帮你去登记的，然后你付的药费都是比较低的，几块钱这样子的。
And similarly, the PACE and PACENet program is a prescription assistance program for Pennsylvania older adults 65 and older.
也有一个 PACENet 的计划，它基本上是帮助住在宾州的65岁以上的居民。
PACE and PACENet can help lower the costs of prescription medication, and there is no resource guideline, so folks with lower incomes are encouraged to apply.
因为 PACENet 他们是没有去看你的资产的，所以这个基本上没有资产的限制的人都所以是很多人都是可以申请的。
PA MEDI can help screen for eligibility for any of these programs and provide assistance with submitting applications to these different programs.
因为他们 PA MEDI 是可以帮忙去看看你筛选你是合资格哪一个计划，然后去帮你去登记的。
In the interest of time, we can skip this slide.
Mm-hmm.
Want to highlight some new Medicare benefits that you may have heard about in the news that are going into effect in the upcoming years, some as soon as next year.
他就是提醒大家有一些更新，有一些新的关于这个红蓝卡的福利的在新闻里边，它通常就是2023年的时候会生效了。
As it relates to prescription drugs, there will be limits to spending in 2024 and a $2,000 maximum cost in 2025.
2023年关于药的话是没有改变的，可是就2024年的话，他们就可能会有一个限制，说可以付这个人需要付多少钱付多少钱呢？然后2025年的时候会有上限是2000块钱的。
And for those who are prescribed insulin, the cost will be no more than $35 copayment per month starting this January. And for those who use insulin pumps, that price cap will go into effect in July 2023.
等一下就是如果这个人是用这个用一个叫就是有一个就是有一个医疗的，就可能就是给35块钱的1月份开始的，这个是有这个叫 insulin pump。对
，Next slide, please. So PA MEDI is a program statewide. Depending on where someone's calling from, they can always contact their county area agency on aging to get connected to the right program. Here in Philadelphia, that's Philadelphia Corporation for Aging.
然后还有就是他们就是他们 PA MEDI 的话呢，在本地都是有办公室的，你可以联系你们本地的这个机构啊。如果在费城这里的话，就是 PCA 就是费城长者机构吧 ，PCA。
So yes, if you don't know, next slide can show the zip code breakdown we have.
Oh, sorry.
That's all right. And the telephone number there is actually incorrect. I can provide you the correct one. So CARIE and Einstein Medical Center split Philadelphia by zip code. Depending on which zip code you're in, that would influence which program you would want to contact. So the telephone number for CARIE is 215.
Okay.
545. 5728.
5728, right?
Correct.
Okay.
And if you are a professional and you're working with a consumer and aren't sure what their zip code is off the top of your head, you can always refer them to PCA and they will route them to the correct program.
OK， 然后如果有些人是不知道这个本地的就是邮区是应该去打给谁的话，都可以打去 PCA 去问，他们就可以去给一个对的电话号码。
And I know we're just over time, so I can leave it at that.
Okay.
Any questions?
Okay. So just also want to confirm. So these slides, can they be shared with the public?
Of course, yes. Social Security Administration would be responsible for Medicare enrollment in A and B, as well as the extra help program. For someone who's working, employer HR department is going to be helpful. Senior Medicare Patrol can investigate suspected instances of suspected fraud. The PA Health Law Project can help with Medicaid.
OK， 它上面就是有一些就是说这个推出局就是 A、B 都可以去申请的，还有 extra help 的机会，然后它还有一个其他的部门是可以帮忙去申请这个就是政府医疗的。I heard that you have been talking about PCA. So do you have the PCA number handy with you?
Let me quick get that. 1 second.
Okay.
PCA's telephone number is 215 765 9040.
Because I know they have multiple departments, so a lot of time it might not going to the right department.
This would just be their helpline number.
OK， 然后就是PCA 刚才说了好几遍，就是 PCA 它就是115-765 9040就是这个电话。So just also want to clarify. So is CARIE also helping with providing help on these?
Absolutely. So apart from our PA MEDI program, individuals, folks who have questions about aging services or help can also call CARIE and speak with an advocate. We'll provide information referral and try to help resolve problems.
Okay, but so for the CARIE, we will have to call the PCA to find out what exactly the numbers is?
No, I can give you CARIE's number.
Okay,
It's the same one as the previous slide. It's 215 545 5728.
Oh, okay, so it's there. Okay, good. I don't need to put it there. Okay. OK， 所以这些情况我都会在我刚才也问他这些我可不可以分享的，他说可以分享的，所以我之后会在我们有一个 database 里边是有把所有的 PPT 还有就是录章我都会有连接了 ，OK， 所以你可以留一下我们微信。So I'm just telling them like all these PPT and recording. I usually I have a database that people with the link that people can click and they can direct them to the place.
Great. And I need to underscore, particularly for PA MEDI, free Medicare help, interpretation is available. For anyone whose primary language is not English, they can expect the same level of help and support through interpretation.
OK， 他也说了，就是他们的部门，他们都是有翻译的，有电话翻译，所以你打电话过去，因为你要求翻译的话，他们都可以在电话上找一个翻译员的。 I just want to also verify, so when they call these number, like, especially like CARIE, like do they need to dial 1 or 2 just to get to a live person? We have a lot of time they can request, but if they can't get to a live person, a lot of times they cannot.
When they call CARIE, they should speak with a live person. If our front desk is not otherwise on the phone. If they need to leave a voicemail message, that message will be in English. However, any message that is left, we either will be calling back with an interpreter. We will be calling back with an interpreter. Any message that is left will get a response if they don't speak with a live person.
Okay.
And that's just a matter of our front desk being on the phone.
Yeah, understand. Yeah, 就是想跟大家说，就是他们的 CARIE 的电话是有真人去回答电话的，可能有时被间线，所以有可能你需要再打，还是用英文简单留你的电话名字跟语言，他们就会打回去的。可是通常一个有真人听电话，你就跟他说中文就可以了。Okay, so there's actually do have a question for those who have Medicare saving program plus extra help. Which one is more beneficial, original Medicare or Medicare Advantage?
Sure, that's a good question, and it's subjective or a value judgment. It's going to be based on cost, coverage, and convenience. That is something a PA MEDI counselor could discuss to better understand what's most important to an individual person. You know, what do they really want out of their coverage, and what are they potentially willing to pay, and provide available options that are reflective of those goals.
对，刚才就是聊天里边有一个问，就是说，如果有些人已经有这个就是有政府医疗也有这个红蓝卡，也有这个 extra help 的，那么他们是应该留在这个就是原本的这个 Medicare 红蓝卡，还是说这个优势计划 ？OK， 这个他就说是要根据这个人的就是要看看这个成本费用涵盖的范围，还有方不方便也要看这个人的他们愿不愿意去付多少钱的，所以每个人的情况是不一样的。Okay, so I guess she saying it's not answered, but I mean I will agree because everyone has. Yeah, everyone has.
I can offer an example. There's no easy answer here. One individual, their top priority might be, I want to see any doctor I want to see. I don't want to get a referral. I want to see any doctor around without needing to deal with provider networks. If that was someone's top priority, original Medicare is likely going to be the route they want to go because Medicare Advantage plans have provider networks.
OK， 他就说就是举个例子吧 ，OK， 很难说，没有一个容易的解释。OK， 有些人可能他们说我要看医生，可是我不要在校性的，我要去哪里看都可以看专科，也不需要在校性，我想去哪里看医生都可以的。那么他们还是留在这个原起的政府医疗这个原起的医疗就是不要申请这个优势计划，因为很多时候这个优势计划都是需要你从你的医生里边拿在校性才可以的。Okay.
Another example would be if someone's top priority was getting routine dental benefits, or they were really focused on a silver sneakers gym membership, then they might be looking at a Medicare Advantage plan. So generally speaking, there is no simple answer as to which coverage is best. There's only going to be coverages that are either aligned or kind of matching what someone wants out of their coverage. It's going to differ from person to person.
然后还有就是如果有些人说我我经常要去看牙科的牙医的，然后有些人可能我经常要去这个就是运动场的，要做运动的，有可能他们就需要拿这个优势计划，这样子的话，这个优势计划才会有这个帮他去付这些费用的所以很难说，没有一个简单的回答说哪一个是比较好的，就是要看这个人主要的通常经常用的是什么福利 ，OK。I think we are running out of time. I'm gonna share those. So do you have yeah, I just want to I'm sorry that Christina cannot answer the questions. Yes, because we are running out of time. But they do have the hotline and stuff, so I'm sure that a counselor can help with that. So David, do you have any last minute remark to everyone's on the line?
Sure. Well, first of all, thank you all very much for your time and to be invited to this group. It's really appreciated. Open enrollment is a busy and confusing time. If you have questions about what is best for you, would encourage you to reach out to PA MEDI for free, unbiased help.
OK， 他就是很感恩，就是可以上来跟大家去分享。OK， 就是我问他有没有另外一些，就是想提醒大家，就是说现在已经是可以登记去换这些医疗公司的了，所以他就是说是很复杂的，然后有时也不知道怎么比较，所以他的建议就是去可以联系他们的部门，他们是可以提供免费的咨询的。OK。Yeah, thank you. So I'm sure that if I'm just also let them know if there's any issues like connecting to PA MEDI or CARIE, they can let us know, come back to us, and we will,
Please, yes.
yeah, we will report that. Yes. 对，就是想跟大家说，如果你们找他们方面是有什么困难的话呢，你也可以跟我们说，我就会找 David 跟他说说有这个困难的。
And if I may, I'm sorry to add, when you call CARIE for PA MEDI counseling, we typically follow up with people in 2 business days, and appointments are usually scheduled within a few business days after that. We have a very high call volume. Not speaking or getting that counseling session right away is not reflective of us. We are working through our list, and we will get to folks in providing that counseling. It may not just be immediate.
So usually the people just call back, right?
They get called back. Yep. Absolutely.
Okay. Oh yeah, David. So I'm gonna also after David left, I will just paste some of the contacts on the chat so you all can have it, and also the slide. I do have I can email the slide to people if you don't want, but I do have a form that you can fill out your email so I can make sure you get the information. And also it will be shared on our WeChat that we have a link that actually connect to these resources. Yes. So let me see if I can find the screen. So I think also just so also David, you can know is we do have.